Great to be here with all of you today. I'm Dr. Leah Janine. We're here to answer your questions about sex and sexual matters with the latest science, research, and a little common sense. Now let's get right to our first question.
Dr. Leah, a man in a new relationship writes, "My girlfriend and I have been together for about 9 months, but we don't have sex very often, about once a week or less. I've tried to ask her what her sexual preferences are so I can make her happy, but she refuses to talk about it. How do I fix this?"
Well, sometimes people feel more vulnerable talking about sex than actually having sex. Clearly, I'm not one of those people. But sex can also be viewed as an embarrassing topic of conversation. So we avoid it or even turn it into jokes. Even within committed relationships, people tend to view sex as like naughty or dirty and something that shouldn't be talked about. Even couples who are reasonably good at resolving other types of conflict often get stuck when it comes to discussing sexual problems in the relationship. So maybe try to understand why she's feeling nervous. People sometimes fear that the discussion will hurt their partner's feelings. People might also think that the discussion will cause conflict or make them feel vulnerable. Or maybe even worse yet, if you reveal too much about yourselves, then you're worried that your partner's going to disapprove of any sexual fantasies or make you feel shameful. I mean, let's face it, we all need our partner's approval. And the fear of losing it's a major reason why people avoid talking about sensitive issues in the first place. There's another reason sex ed is severely lacking in the United States. There are two basic forms of sexuality education: abstinence only and comprehensive education. In abstinence only education, you're taught sex is bad, it's very morally prescriptive. In comprehensive education, you are taught a little bit more about how to protect yourself, but we're only looking at it in terms of STDs and avoiding unintended pregnancies. So many Americans simply do not know enough about their sexual anatomy, and few people understand what goes on our bodies during sexual activities. So it's not surprising that people become embarrassed about their ignorance when it comes to sexual matters. It also makes sense that she's going to feel vulnerable. She may think her desires are weird and that she fears that you're going to feel the same way. So learning to overcome this embarrassment about sex and developing a proper sexual vocabulary really takes effort. But just tell her you're not a mind reader. Explain to her that you want to share her expectations. You want her to share her expectations to you. So whether it's likes, dislikes, whatever, you want to learn more about how to please her. So I would start by establishing some trust and intimacy with some easier topics, then maybe progress to some hypothetical ones, then discuss what feels good to you, what doesn't feel to you, maybe ask her to reciprocate the conversation. Just make sure not to bring up anything that might make her feel threatened. Obviously, don't criticize her performance or anything like that. I would start with some basic fantasies, nothing too crazy in the beginning, and just see how your partner responds. Hopefully, she'll see you as being vulnerable. And by the way, only half of the couples actually discuss their fantasies, but those are the people that report the happiest sexual relationships. Keep in mind, when you have this discussion, timing is important, right? So after sex, there's an increased amount of oxytocin, that bonding chemical, and maybe that's going to make it easier for her to feel a little more vulnerable talking about sex. Another way, talking about sexual fantasies when you're already aroused. Maybe your partner is going to be a little more receptive, loosen up, I don't know, have some wine, watch a sexy film, whatever takes the edge off. Next question, please.
A concerned partner writes, "My boyfriend recently started getting terrible headaches right before he orgasms. He gets a terrible pain on the top of his head, and each time the headaches last longer than the time before. Any insight?"
Sexual activity may cause headaches, especially in orgasm. Most sex headaches are nothing to worry about. There are actually two different types of sex headaches with different causes. One's going to be a sudden, severe, throbbing pain in your head, and that'll happen like right before or after sexual release. The second type is called a sexual benign headache, which they start as kind of a dull pain in the back of the head and neck, but then it builds up as you become more sexually aroused. Then that can lead to a more painful headache. Then, worse yet, there are some people, unfortunate people, that get both types of headaches at once. There are some very rare cases where head pain during orgasm might indicate a serious issue. So if your headache occurs with any other neurological problems like a stiff neck, vomiting, anything along those lines, it could mean that you have inflammation, a brain hemorrhage possibly even a tumor, but this is really rare. It's just important to see your doctor, but just remember, sex headaches are typically not associated with any underlying condition, so taking an over-the-counter pain reliever should be just fine. If this doesn't work, you can see your doctor and they could also prescribe something to prevent the onset of sex headaches, and those can either be daily or just taken as needed. Okay, what's next?
Dr. Leah, a middle-aged woman, writes, I'm a single woman at the start of a new relationship. We're both in our 50s. He says he's not interested in using a condom because we can't get pregnant. But I'm still concerned about STDs. What should I do?
It's a good thing that you're still concerned. So talking openly and honestly with a partner about condoms is important. So I would start off with saying, well, I want to know why he's so disinterested in wanting to protect themselves against STIs or sexually transmitted infections. If he says something like, well, it just isn't as sensitive, then you could say, well, I'm okay with it lasting a little longer. Or if he's bothered that a condom interrupts everything, then offer to help put it on. Some other things guys will say, if he says, it just doesn't stay hard, then you can flirtingly say like, I'll do something about that. You have answers. Just find out what his reservations are. If he is still being difficult and you still want to have sex with him, which I might reconsider if he's not willing to take into account your needs, then you could always go with him to get tested. Keep in mind, you can get tested for most STDs, but there is no FDA-approved test for men with HPV. They have a swab test, but it's not approved, and there's really nothing you can do if a man tests positive. Unlike with a woman, when a woman has abnormal cells on her cervix, it can be removed, preventing it from developing into cervical cancer. But if a test for HPV comes back positive, the only thing you can do is wait for the virus to clear if it comes back positive in a man. So there are no treatments that can kill the virus once it's in the body. So good luck to you.
HPV is a viral infection spread by skin-to-skin contact. Most sexually active people will have at least one HPV infection at some point in their lives, according to the Centers for Disease Control and Prevention. In 90% of HPV cases, a person's immune system fights off the infection within 2 years. The problem is, there's no way to know who's in that other 10% that will develop potentially serious infections. While HPV in men is often asymptomatic, it can cause genital warts or certain kinds of cancer like penile cancer and forms of oral cancer. In fact, every year in the U.S., more than 14,000 men get cancers caused by HPV. In women, certain strands of HPV can lead to cervical cancer, the fourth deadliest cancer among women worldwide. The American Cancer Society recommends HPV screenings every 3 to 5 years for women ages 25 through 65. There are currently no cures for HPV, only ways to treat the health problems caused by it.